Iliana is fierce.
She is bright. She's tough.
She is absolutely adorable. Everything was normal for the first few months, and then I'd say probably around the summertime, we noticed she was getting sick quite a bit.
In September, that's when everything changed. So she was being fed her bottle. The bottle dropped on her, and she started crying and then passed out. She ended up doing this crying and passing out episode again later that day. So we went to Connecticut Children's urgent care.
Iliana came to us in a little bit of an unusual fashion, actually. She presented with what appeared to be some breath-holding spells, and as part of that evaluation, had an EKG performed. That EKG showed some abnormalities, so she was initially referred to our Department of Cardiology here at Connecticut Children's, and that is where she met Dr. Alex Golden. As part of his evaluation, he then obtained some labs, and those labs revealed that Iliana had severe anemia. And shortly after that, a bone marrow biopsy revealed her diagnosis of acute myeloid leukemia, or AML.
I remember that first night, I don't think I slept at all. I heard every single click that the IV machine was making.
It was honestly just a shock. It was really like an out-of-the-blue diagnosis for us.
It was honestly crushing. I mean, talk about your world crashing and falling down. It was unimaginable. Once we got the leukemia AML diagnosis, they right away wanted to start her in treatment immediately.
She spent long stretches of time in the hospital. And with that resulted in spending her first birthday and several other major holidays and first holidays for a patient of her age.
Our whole HEMOC team was honestly great. They cared about you as well as Iliana. They really take the whole family into consideration when they talk to you about things, when they talk to you about diagnoses, issues.
I really can't say enough about the nurses. They were beyond amazing. Always made us all feel super welcome. Always answered any question, quelled any anxieties we ever had. I mean, they were amazing.
She spent 5 months receiving care here at Connecticut Children's with chemotherapy in our hospital before moving to Boston Children's, where she received her bone marrow transplant.
We had to kind of uproot our lives and live in Boston during the hospital stay. So we basically, for the last 6 months, have been in Boston 6 to 15 days a month, like going to appointments in general.
It was almost impossible to work. Yeah, we had to financially account for that. We had to be, fully present for them. It takes every ounce of you to battle a disease like this.
When we talk to patients at their initial diagnosis and tell them about the intensity of treatment and the length of treatment, one of the things that's really hard is to tell them that there's a portion of therapy that we can't do. That doesn't feel great, and it actually makes it feel like we're not able to give them the care that they really deserve. And it really does us a disservice to tell them that we're not capable of a portion of therapy. So the great thing about the tower is that there's going to be a new advanced cellular and gene therapy unit, which will bring bone marrow transplant and other immune therapies to our patients. They can get these cutting-edge therapies close to home and don't have to travel out of state.
When families don't have to travel as long, that gift of time back could mean so many different things. It might mean that they get a play date with a friend they haven't seen after school, but it also might mean that there's a sibling who woke up this morning and today they get to have breakfast together. Having care closer to home means more little moments, not just big moments, but even little moments that matter so much to families.
I can imagine how much easier it would have been if we only had to travel to Hartford.
Our commute was a half hour versus 3 hours. It would have just lightened the load on us tremendously. We lived apart from our support system for a couple months. Having it all wrapped up at Connecticut Children's would have been the ideal situation.
There's a very special bond between the clinician team, the nurses, the doctors, and the patients and families that's created through that diagnosis journey and as we begin into treatment. And it's very disruptive and sometimes emotionally difficult for the families to create new bonds with new team members and have to travel so far for care. Connecticut Children's has grown so quickly, and to see the tower go up, I know that there are so many more patients and families who need not just the clinical care that we can provide, but the environment in which we care for those children.
This is what our patients want. It's what they need, and it's what they deserve. Building this program is responding to the voice of our community, and I would encourage people to put themselves in Iliana's parents' shoes and imagine what they would want for their family.
Connecticut Children's is just so important for families. I can't think of anything better to donate to.